Great. It's exciting to see folks joining us today as our attendee list grows and grows. So we'll go ahead and get started in just a moment. All right, well, let's go ahead and get started. First of all, just let me welcome everyone that's joining today. I want to thank you for taking time out of your day to join us for today's webinar. We're really excited to dive into the topic for today. Answering this question, is retail pharmacy missing signals to the future? And I hope you'll find that after our time together, you'll know where we stand on this question in particular. So I'm going to be your moderator for today. My name is Christine Nelson. I'm an executive vice president at KS&R, where I lead our healthcare practice. Over the course of my career, I have had the privilege of seeing the industry both from the client and the partner perspectives. I've spent the past 15 years of my career calling KS&R my home. I really love leading our healthcare team. It's really rewarding. On a daily basis, we're collaborating with clients in the pharma, med device, and biotech spaces. And today I am really thrilled to be joined by a member of my healthcare team and an expert that I deeply admire, Patty Trainer.
Well, thank you, Christine. So I am Patty Trainer. So most of my career has been on the vendor side, particularly in healthcare, where I have over 25 years experience. And I've seen many changes since the early 90s in the retail pharmacy. And so it's interesting to see how this whole channel has evolved and some not so much maybe in that time. And as a subject matter expert in pharmacy for KS&R Healthcare, I'm especially looking forward to today's discussion.
Yeah, so before we begin, I just want to let everyone know that please feel free to add any questions that you might have over the course of the discussion in the Q&A section of the webinar, and we'll see how many of those we can fit in after we hear Patty's point of view on a number of things. So today we're exploring whether retail pharmacy is keeping up with the rapid evolution of healthcare. So Patty, to get us started, what makes this moment so critical for pharmacy?
Yeah, and I think you'll see on your screen a quote from one of our retail pharmacists on our panel that talks a little bit about the concern for the changes in pharmacy. So we're seeing margins shrinking, closures are rising, and consumer expectations are shifting fast. In fact, when you think about pharmacies, they've been the front door to healthcare for decades. But unless they evolve, that door could close. And first, let me just back up and think about impact. So for reference, there are over 50,000 retail pharmacy brick and mortar locations in the US. A statistic, which I believe comes from the NACDS, that's the National Association of Chain Drugstores, shows that about 90% of Americans live within 5 miles of a retail pharmacy. That reach is unmatched by any other brick and mortar site of healthcare. So even just 10 years ago, I think that statistic was 93% within 5 miles of retail pharmacy. So it's still substantial. Another point, pharmacists we know spend between maybe 50 and 75% of their day dispensing medications. So even with mail order pharmacies, it's clear that there is demand for the local pharmacy. So at KS&R, we classify retail pharmacies into buckets. So 3 main buckets. First is that pharmacy-based operations. Think of Walgreens, CVS as those pharmacy-based locations, along with regional local pharmacy chains, things like Kinney Drug in our area. Regional could be Thrifty as well, Thrifty drugstores. So the second group would be mass merchant, and Walmart dominates this area, along with, you've got Costco and Sam's Club as well, making up those mass merchants. And the third group would be grocery store operations. So big chains like Albertsons, Kroger's, Wegmans locally for us, they typically have a pharmacy within the grocery store. So in terms of size, largest of these in terms of pharmacy location count are CVS and Walgreens, making about a third of that total 50,000. Making up another third of the total are independent and regional pharmacies. And the last third would be mass merchant and groceries. So that's roughly, it's not precise, but just to give you an idea of the size and scope of the reach of retail pharmacy. So some of recent news of retail pharmacy closures is likely to be right sizing. So since we know, population shift and, maybe they don't need a location where they had it or it's overpopulated. For example, CVS, we know owns about 9,000 locations, just announced a number of Rite Aid locations they're taking over. So they're adding locations while they're also closing hundreds of stores across the country, for example. So we do see, some of this right sizing going on, but overall, there seems to be a trend downward in the number of retail pharmacy stores in the US in recent years. So you can see the quote on the screen. There is concern. We recently polled our pharmacy panel, and 8 in 10 are concerned about the recent uptake in these store closures. They're citing PBM pressures, pharmacy benefit management. That's what PBM stands for, if you're not aware. Also, operational strain from having fewer workers in the pharmacy, but the same amount of work. Some cite a bleak career outlook. They're not sure where to go from here outside of retail. And then lastly, a concern for patient having access to the pharmacy are contributing to these concerns. So we have seen since the pandemic, the convenience is continually on the rise for consumers while they're utilizing mail order pharmacies. This trend of convenience can put these physical stores out of business. It's not just in pharmacy, we see it in other retailers, but there's a cost to that convenience. Losing your retail pharmacy, what does that mean? It means that when you leave your doctor's office with an antibiotic prescription sent to, you can't fill it at your local pharmacy if you don't have one. So it's a concern, not only for pharmacists, but maybe we should be more concerned about this as consumers.
Right. Oh, it is certainly sounds and is based on our everyday and partnering with clients and all the things that you've shared. Um, Make it a very critical moment in time. I mean, this isn't going to stop, as you alluded to. So, what are the key, I guess we can call them warning signs that retail might be missing what's to come?
Yeah, so I think it's a matter of what you're paying attention to. I mentioned 50 to 75% of a pharmacist's day is spent dispensing prescriptions. And it's really hard to get out of that, day to day when you have a customer waiting at the counter for their prescription or at the window, the drive-up window waiting for their prescription. So, that yesterday's pharmacy is still very much alive today. It's very transactional, it's shelf heavy. They have to carry the inventory so that they can meet the demand and they're reacting to whatever it is they need to do next. They're not able to take the time in that 25% of their day to do other things that could help them. So, in a nutshell, warning signs are store closures, this operational stagnation, a lag in maybe adopting technology that could help with that dispensing process. So, innovation is happening all around pharmacy, but maybe not within it. Awareness exists, this is a problem, but execution is lagging. So, I think a major shift just needs to take place from that traditional model. Is retail keeping up with what consumers need in order to be the most accessible point of care? Perhaps they're focusing on the wrong things operationally, but have the right attitude about that customer or health focus, health and wellness focus. So I would dive into a little bit of a rabbit hole here, but I want to talk a little bit about an example. So other revenue streams to keep these brick and mortar locations alive may be a distraction to their core focus of health and wellness. So with majority of their time still focused on dispensing scripts. We're not seeing as much to a central fill, adopting a central fill where some of that could alleviate the local pharmacist um, tasks that they have to do as you'd think. Um, and then there's a conundrum of like, I've got this large footprint in some of these suburban areas, like even myself, as an example, within 3 miles, I have 3 pharmacies that I could go to. Within five, it's probably double that. So there's a lot of locations accessible to me, but they all have fairly large footprints. So how do you make a float of it? To have the best ROI, it may not be from the pharmacy operations alone. And, case in point, Walgreens just recently announced taking on Party City within their store to add a revenue stream, which is not couldn't be further from healthcare or the pharmacy in terms of, their focus on health and wellness. So does it distract or dilute that wellness image? It might. But you have to make a go of it if you're going to keep the pharmacy. And we know the problem with pharmacy is not so much that they have so many scripts they're dispensing. The margins are very thin on dispensing scripts. So you have to operate on volume with all of those scripts to help support the pharmacy, but it's still not enough. You need other things like vaccines, you need medication therapy management, things I'll get into in a little bit on that. So signs, we see other retailers, there's signs like Bed Bath and Beyond partnering with Overstock.com to become an online retailer. They no longer have these huge brick and mortar stores that carry all of this inventory. They don't need to. They could do this obviously online and meet the shopping demand. Unfortunately, it's not really the same as pharmacy. Again, I appreciate that I can go to my pharmacy and get my antibiotics, on demand, and have that local convenience for that, which I don't know that I'd want to wait online for unless I can still get that same day delivery.
Yeah, speaking of delivery and this like changing dynamic, how do you see mail order and local pharmacies coexisting, even in the next 5 years, let's say?
Yeah, it's my opinion. It's probably not an all or nothing. Mail order has been around for a while. There's pros and cons to that. Reduced cost. You can get 90 days at a time, for example. But, sometimes things are delivered in, very hot or very cold conditions, and you wonder about the efficacy of your medication. So it's likely to be a hybrid, so an increase of mail order to help support chronic medications, but acute medications being supported either locally, or maybe through a same-day delivery via hub or other local spot. Pharmacy may be that spot, maybe it's Amazon, with more attention dedicated to that health model we've discussed. So if pharmacy is that spot and they can meet that demand and keep, their operations afloat, that would be a way they can coexist. But I think they'll need to still bring in other revenue streams to support that big brick and mortar footprint. And it could be also through partnerships, maybe even at the local level with, clinics or urgent care sites or other healthcare sites of care that could sustain pharmacy and help keep them health centric.
Yeah. I know you and I did want to take a moment just to do a quick poll with our audience today. So you should all see an easy, quick poll pop up in front of you. Have you personally ever received a prescription outside of the brick and mortar pharmacy? An extreme, question, simple yes, no, but something that we think will be really beneficial to kind of pause and take a look at. Um, We'll leave this open for just 5 seconds or more, just trying to get a quick read on you all. And so we'll take a look at those results. Hopefully perhaps you can see them, but it looks like about 3/4 of you have done so. A quarter haven't, but just goes to show this trend where it's not all happening in the brick and mortar store, that there are perhaps sub-channels of pharmacy that we're starting to see. Patty, in your opinion, how are consumers like us, everyday folks, our behaviors reshaping the role of pharmacy and that even of our providers?
Yeah, that's a great question. So, I think pharmacy's differentiator is trust in their pharmacist advice, their medical education, the accessibility to the pharmacist. You can walk into a pharmacy and ask to speak with the pharmacist directly without having to worry about a copay. And certainly the reach, again, 50,000 locations across the US. So even for and especially for underserved populations, that's important. So thinking about consumer behaviors and that of the provider, providers are now emerging in more places than ever, conveniently available online almost anytime, anywhere. You can reach a doctor via telehealth. Where people go for healthcare and medications is changing. So a case in point, whoever heard of Hims and Hers Health even 3 years ago? I know they've been along for longer than 3 years, but really there's been an uptick, a surge in the use of these type of healthcare providers, DTC consumer type providers. So I think with the pandemic reshaping how we use our times, consumer are expecting convenience more than ever. So that the service of telehealth, on-demand care support these values. And as such, pharmacies really need to shift the mindset from dispensing to consumer engagement. And that's a major shift for these organizations when, most of their time is spent dispensing and has been for so long. Um, so I think part of the conundrum is pharmacies are readily accessible in most populations, but troubled by those inefficiencies in the dispensing process. Their margins on scripts are thin. There's a growing concern for closures of stores serving these pharmacy deserts. We call it deserts when, areas where, the population may be sparse and may take them longer than, 20 minutes to find healthcare, even if it's a pharmacy. That further exacerbate the problem with healthcare access. So with consumers changing that relationship with their provider, there may be an expectation that the pharmacy needs to catch up with that. So the reshaping of pharmacy needs to be agile enough to address consumer needs for convenience. But if you've ever been to the pharmacy and spent time in line, you know that that's the antithesis of convenience. So mail order, prescription kiosk where you put prescription in and it gives you your medication, or even just making sure the pharmacy is just ready to meet the patient when needed without the wait will be key differentiators to the trust, accessibility, and reach that they already have.
Let's switch gears for a moment and talk about innovation.
Mhm.
So, in a future where automation handles most prescriptions, what do you see the future role of the pharmacist will be or become?
Yeah, I still think there's a great role for pharmacists. I mean, I think automation, including AI, could free pharmacists to deliver care. CVS, 9,000 locations, has 900 minute clinics. If you've ever heard of a minute clinic, it's basically a miniature healthcare center within the pharmacy. So where you could see somebody, if you're sick, they can help take care of you. So it's not just vaccines or consultations, but those could be included in that. It's any kind of support to help the patient. So will there be more minute clinics? I think there could be. That could be a way pharmacists could have more time to be able to support that, or maybe even if it's just for acute therapy. So I want to talk a little bit about consultations. So because I mentioned medication therapy consultations, we call it MTM. So Medicare reimbursement for medication therapy management, MTM, doesn't exist without pharmacists being officially deemed healthcare providers. So without that healthcare provider status, it's a little loophole here, but they cannot bill for or get reimbursed for that consultation. So, pharmacists will still consult with patients now without being, reimbursed for that time. But if you think about the day, the way the day goes, and 75% of your time is spent dispensing scripts, that leaves very little time to be proactive in medication therapy management, consultations with customers, or talking to them, or answering their questions. Lines are real. the closures are shrinking the number of stores in operation, but not shrinking the work that needs to be done with the few that are remaining. So I think there's a role for pharmacists in the future if they get past the dispensing problem, to partner with, other healthcare providers, whether it's telehealth or other data platforms, to help accelerate the transformation, allowing them to be more engaged with their customers and help them with their medications, or just understanding, how to maybe streamline their medications, or make sure they're not taking more than one medication that's really doing the same thing, which can be a problem. So when we look at the strides using AI in our own jobs here, it wouldn't just surprise me to see AI eliminate much of the current role of the pharmacist. So it's a big change, though. I don't think pharmacists will be very comfortable with that at first, because that's all they've known for so long. But I do believe they're fully capable of excelling at it, because it does give them more face time to help their customers. And what we've heard from pharmacies over the years is that pharmacists is that that's why they went to pharmacy school. They wanted to work with customers. They wanted to help people.
Yeah. And I mean, you for one, just spend time with our pharmacy panelists and really know what their worries are, what they think about the road ahead. So, in your own terms, what's at stake if the pharmacies that are employing these pharmacists don't evolve themselves?
Yeah, I think it's a matter of risk of irrelevance. They'll become irrelevant. People will be bored, won't put up with long lines, or someone else will find a way to figure it out in a way that meets the customer needs for convenience and urgency. So I think consumers will migrate to more of that telehealth, mail order, urgent care, and pharmacies could become the least convenient option if they fail to modernize. So recently, if you don't know what a GLP-1 is, it's weight loss medication, and it was originally for managing diabetes. It's been very effective at helping people lose weight as well. But because the demand was so great, the manufacturers couldn't keep up with the demand, and there was a major shortage. So we saw very quickly a number of telehealth sites popping up to satisfy a need for GLP-1s by offering a compounded version of semaglutide, tirzepatide. So places like Join Fridays, Mochi Health, Willow Life, there's so many. There's a long list. And so many more were ready to and nimble to
Mhm.
consult, prescribe, and arrange for expedited compounded meds to be shipped to willing customers. Um, and customers were willing to pay out of pocket for this. Wasn't something covered by their insurance necessarily. So there's an opportunity, I think, for that comprehensive, holistic care to not only address the pharmaceutical demand, but to also to guide the whole weight loss diabetes journey. They proved that recently. Um, it's not happening so much now that GLP-1s are, basically readily available by manufacturers. But, many of those pop-up telehealth, they may have gone away, but not before capitalizing on what consumers needed in the moment. Again, so we're seeing consumers driving the course of the future. We see Amazon. Amazon's been in the game for a while now, but in healthcare, we're going to see them more and more involved. So consumers, again, continuing to migrate to easy, convenience, and access. If they feel it's worth it, they won't bother with their insurance or regular provider. So this really isn't a new problem, though. We've been talking about the need for pharmacy to evolve for I presented in a conference just a couple of years ago on this topic. Personally, I still want the convenience of picking up my acute meds locally, but I actually probably would be okay if I could get them delivered to me just as quickly if that were my only option. So with that said, what about the convenience of talking with your local pharmacist? If you have a quick question and you can't get to your provider, your pharmacist is, open every day of the week, pretty much in most areas, and will be able to talk to you if you have a quick question. They'll take the time to talk to you. So, there is, we lose that if stores close and we switch to a completely online or, convenient mode of getting your prescriptions filled.
Well, let's boil it all down, I suppose, as we round out our content. What are your thoughts on the signals that and the pharmacy leaders should be watching most closely, I would say?
Yeah, I think, continue watching this technological disruption. How will Amazon play out in the space? Are there others that will also play out in the space? Will consumers go direct to the manufacturer for their medications and bypass the pharmacy altogether? Um, so looking at expanding scope of practice policies, shifting patient expectations, those are all things that they should have their thumb on. Because the pharmacies that do act on these things early will help define the future and preserve a space for themselves.
Yeah, I couldn't agree more.
Mhm.
Well, we do have a number of questions, so I'm going to get myself organized and hope you're ready. We'll just see how many we can get through over the next, 4 or 5 minutes. So, um, let's see. When you are speaking to pharmacy leaders, what is the big internal blind spot that you see in your discussions with them? What are they not paying attention to?
Yeah, when you think about pharmacy leaders, not necessarily pharmaceutical manufacturers, but pharmacy leaders, I think them trying to imagine pharmacy as anything but a brick and mortar store and not
Mhm.
embracing partnerships or entertaining new models that could keep them relevant in the future is definitely a big blind spot.
Okay. Um, what technology investments should pharmacies prioritize now? Right now, I guess.
Yeah, I think, anything that would help them become more efficient in dispensing medication. So that, thinking about automation to streamline prescription filling, whether it's central fill or, whatever things that you could do. I mean, we do want QC processes along the way when scripts are being filled, but the much of what we do is very manual. And I think there's a lot of, insurance back and forth looking that up that kind of can derail that.
Mhm.
Um, Patient engagement platforms. So we need that. You need that. You need to keep establish that connection with the consumer. If you can't talk to them at the counters, having some platform that help facilitate scheduling, increasing loyalty to your pharmacy can only help. Um, and then finding a way maybe to help with that telehealth integration to link pharmacists with remote care in a better
Hmm.
way.
Yeah. Oh, that's a
Yeah.
great idea. Let's see. There's a question here. How can pharmacists advocate for provider status more effectively? Since I'm glad someone asked this because you have spoken about this for many, many years, and we're not there yet, as you mentioned today.
Um, no, it's tough, right? Because physicians don't necessarily want to compete with pharmacists for, provider status. They want to be the ones providing that consultative service to their patients. They want to control that. So, there are organizations advocating for this strongly, still not there yet. So I think, collaborating with associations to push that federal policy change is be important. Um, Finding a way how you could prove your value through clinical outcomes, ROI data, like are you helping keep patients on their, refills on their medication and showing that they are, compliant, that they are improving. Anything that you could do there. I know specialty pharmacy does that quite a bit, less so in the retail. Um, but again, partnering locally with health systems and payers um, to get them on board that this is a need for the community. Um, Anything like helping to leverage like consumer advocacy could help as patient demand will drive that recognition. So if patients need it more MTM or consultative. Again, they're going to help drive that provider status change.
Yeah. There's another really great question here, which I think will be great to end on. It says, how will this change how manufacturers engage, or might even ask, should engage, with the pharmacy channel going forward?
Yeah, that's a great question. And I think I would love to see more manufacturers really dive into this too, because as I mentioned at the beginning, 90% of Americans living within 5 miles of a retail pharmacy is incredible. It tells, as a manufacturer, I would want to make sure I'm helping pharmacies support what they need to reach the underserved, or through the regular channels through pharmacy education or tools to help with consumer education and discussions. So it's a great opportunity to connect with pharmacists where they are to help reach the customer. And if you want to help patient outcomes, pharmacy is a great way to do that.
Oh, what a great discussion. Patty, thank you so much for allowing us into your brain, into your decades of experience in this space. It's a true asset to KS&R, a true asset to our clients. And I'm just so excited that if whenever anyone wants to tap into your brain and your expertise, that you're always willing to share that. So thanks again for being our special guest in today's webinar. And for all of you in attendance, thank you so much for being here. Thank you for joining us and taking some time out of your day to spend with us.
Yes, thank you. I really appreciate the opportunity. And yeah, I'll look for the recording, and looking forward to hearing any feedback you have outside of this. Thank you. Have a great day, everyone.